afternoon and welcome to United TV. This is our Bariatric Friday event. Today is January 26, 2024. My name is Kemal Erkan. I'm here with Dr. Isaias Irgau, one of our bariatric surgeons, and he's the head of our program at American Surgery Center. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Thank you again for another session of Bariatric Friday.
Of course, it's our pleasure. So it's a lot more fun to talk about this than all the global conflicts that we talk about in our other events. It's less depressing because we are helping those individuals who are looking for better options and better choices for their lives. And we want to be able to help more people. So today we are going to discuss the life after bariatric surgery. What can we expect? What one can expect after the surgery. So our goal is to prep our patients for what's coming because bariatric surgery is a very powerful tool. It's going to help those who are looking for weight loss solutions and options because it's a significant weight loss that we are expecting. Therefore, we are also expecting certain changes that are very important for one's life. So that's where Dr. Irgau, you are going to help us to prep our patients.
Absolutely, absolutely. So we have several sessions, obviously, as our audience knows, where we go over many different aspects around bariatric surgery. And the idea is to reinforce the knowledge, of the people who have it, but also to inform a great deal of the public who has, not been exposed perhaps to bariatric surgery. It is important to reiterate again that bariatric surgery is a very serious medical treatment that tackles a very serious disease, which is morbid obesity. It is one of the most scrutinized areas of surgery where the level of safety has been really lifted to extremely high levels. It's one of the safest procedures we do for complex disease currently. And people are candidates for bariatric surgery when they have extreme levels of weight, when typically their weight is about 100 pounds higher than their ideal or healthy weight. And another way to talk about that is to talk about body mass index, which is a number that is calculated by putting the height and the weight of the person together. And we say that a body mass index of 40 or greater can make a person a candidate for bariatric surgery. And sometimes even a body mass index as low as 35 can make a person a candidate if that person has already advanced to complications of obesity that manifest in terms of diseases like type 2 diabetes, high blood pressure, and sleep apnea. And we talk about candidates for bariatric surgery essentially to say that, people have to be offered this form of treatment when they reach that levels of obesity, because other methods don't work as well. They're not as effective as bariatric surgery. And going to our topic today, we're going to talk about what to expect about, after bariatric surgery. We're going to really generalize the topic in terms of, diet and advance of diet, but also we're going to specifically look at our program as well, what our patients who go through our program would expect. And one of the key differences between our program and many others is that we perform bariatric surgery in an outpatient setting by and large, right? Where patients actually come to our center, bariatric center, the American Surgery Center, to have bariatric surgery. They have the surgery, there is a period of observation of several hours, and then they go home that same day. And over 99% of our patients are actually going home that way. So patients will expect that, they will expect to go home that same day, which means that we're able to control the discomfort that comes after surgery. We're able to control nausea or other after effects of anesthesia effectively, and then they are comfortable to go home. They will be walking out of our center at the end of that day. When they go home, the key difference for bariatric patients is going to be, eating. In fact, there is not going to be any eating for a couple of weeks. They will be drinking fluids, right? Because they're going to be on a liquid diet. And a liquid diet is defined as anything that is drinkable, essentially, right? But it doesn't mean that any fluids are permissible. It's very important for people to understand that. The number one goal at this stage is to make sure that patients are well hydrated. So the to-go drink is going to be water, but many other water-like drinks will be very much okay as well, whether it's crystallite, whether it is different types of light soups, whether it is different types of protein drinks, decaffeinated tea, decaffeinated coffee, Gatorade Zero, this will be fine. The no drinks at this stage are going to be things like, juices, definitely no alcohol, definitely no high sugar drinks either, right? Now, so there is a big limitation as to what they can have by mouth in the first 2 weeks, in that they're not going to be able to eat any food, but they're going to have soft drinks. And people may be worried about that, saying, oh, I'm not going to be eat. How about hunger? Well, the beauty of it is that after bariatric surgery, there's no hunger, right? Hunger becomes a memory, at least in that early stage after bariatric surgery. So patients will not have to worry about hunger, but they have to really focus on drinking. And why do we place so much emphasis on drinking, Kemal, is the fact that quantity-wise, there will be limitation to how much they can physically drink at any one time, right? So if you and I, who've never had bariatric surgery, are thirsty, we can just get a glass of water or a bottle of water and just drink it like that, right? When you've had bariatric surgery, the stomach is so small and the pressure within the stomach is so high that patients are not going to be able to gobble a lot of water like that, right? There will be limitation as to how much they can drink. So the strategy that we tell them that will work best is that of drinking small amounts, but frequently through the day, right? We want them to drink a lot, in that the body requires the same amount of fluid that they did before the surgery, but their ability to drink big amounts in one setting is limited. So they have to really learn to drink small amounts continuously. Now, what happens if they try to drink a lot of fluid at once? Well, they could have discomfort, because what happens is, let's say after the sleeve gastrectomy, for instance, they have this stomach that is shaped like a banana. So it is very small, but it's not just small. It's also very stiff that early after surgery, which means that as soon as it's filled with some contents, the pressure inside that stomach tends to rise, right? And that rising of pressure will be transmitted towards the food pipe, and the food pipe does not like pressure. It likes a very relaxed organ below it. So that pressure could be felt as a discomfort. And patients will very quickly learn that if they get distracted and they try to drink too much at once, they will feel it. So what will they expect that early? That is that we will expect in terms of drinking.
So, Dr. Connection is going in and out. I don't know if it's related to the letter or not, but
I did notice that. Come on, let me make sure that my internet is actually fine. And
while you're explaining that, so but while you are checking that, the medical monitoring after the post surgery is one of the things that we also expect our patients to follow. There are certain visits with certain frequency that we want to see them. We want to see them in Riyadh by our surgeons, by our providers, but we also want them to follow up with their primary care to make sure that all these changes are being, number one, is recorded, but also there's the proper support if certain things are not working out. One of the issues that we have seen now, I'm not a surgeon, but I'm part of the program since 2003. That's 21 years. And the last 13 years, I'm actually managing Riyadh, and the last 8-9 years with Surgery Center. So the biggest problem that I see from a non-surgeon standpoint is how once patients see these really incredible weight loss, they stop following. They stop no-showing because we set up these appointments at the time of the discharge from the surgery center. However, the problem that we see is when you have someone who's 320 pounds, now they're down to 195, they feel like they don't have to follow up with us or with their primary care. It's a huge mistake because to make these changes permanent and make sure that you are getting the most amount of support is it can only happen if we see you on those visits that we are planning to have you. And based on that, we may actually have nutrition support. We would make sure that you are getting your vitamins and other things that you may have. Now, of course, what happens when we have these great episodes, so then you go and watch these and then you don't think you should come for a visit. No, this is not replacing those visits because the change that one is experiencing is extremely big, and you can't really just because you have good results doesn't mean that you should stop seeing the medical professionals. So the nutrition supplements, this is going to be another really important issue that we expect you to follow up because now with the food consumption being a lot less, I mean, from the food that we already eat, we don't really get proper support, proper vitamins anyway. So if you are not getting your vitamins, nutrition, that is another thing that we want you to follow. And also, there may be some other, potential complications that may be happening, right? So this may be not visible to you, but maybe visible to us if we follow up with you and make sure that the lab work and other things that may need to be done on a regular basis. Based on those, we may be picking up certain things. So this great change has so many different reasons. A lot of people, yes, they do want to lose weight, but the reason they want to lose weight is because they want to have a better life. So better life, better quality of life. So all that is important, which comes with the weight loss. But unless we do certain things, take some preventive measures, we won't be able to help. Though that's only going to help if we see you more frequently.
Absolutely, absolutely. I mean, it's very important to understand that bariatric surgery should not be about trading one illness for another. I mean, we want to make people very, very healthy in all aspects. And clearly, if there is no regular follow-up, there is a danger for patients to develop problems in the long term, particularly related to malnutrition, essentially, right? So that follow-up is very important from our point of view as bariatric surgeons. In a way, we see ourselves as chronic conditions managing physicians, almost like a primary care doctor, right, who is managing patients for their life. That's the way we see our patients as well. They need to be with us for the long term, essentially. So this is obviously much more important at the beginning, where the changes are going to be much more significant. And of course, early on after surgery, as we've said many times in our platform, we do have a fairly specific follow-up schedule that starts about 2 weeks after surgery, 1 month after surgery, 3 months after surgery, and so on. But also we do tell our patients that we are open 24 hours a day, right, for any problems that they may encounter. We expect patients to progress, meaning that every day that passes in surgery needs to be a better day than the previous one. And if they, for some reason, they feel they're going backwards, they need to let us know. It may be nothing, it may be something that we need to look into. So this connection with our practice has to be organic, and it has to remain for the long term, for people to remain healthy in the long term. So just going back, for instance, after that early time, I tell patients that, if they experience something and they think, should they call our office or not, that thought by itself should trigger calling us, right? It's better for us to be called and know that everything is fine, than not to be called and then having to deal with a problem that could have been resolved earlier on, whether it's dehydration or other potential symptoms, essentially. So that is very important. Reaching out, as you mentioned, is very, very important. Well, what in terms of follow-up, what other changes could happen, Kemal, that are critically important at this stage? Well, as you mentioned, for instance, many of our patients, as a complication of obesity, they will have things like high blood pressure or type 2 diabetes. And as soon as they start losing substantial amount of weight, there may be dramatic improvement in those conditions, right? They may normalize their blood pressure within weeks after weight loss surgery. They may normalize their blood sugar within weeks after bariatric surgery. Now, if things are normalizing naturally inside their body, if they are taking medications on top of that, now the blood pressure could go too far down, or the blood sugar could go too far down, right? So very often patients may not be aware of this, but we want them to be aware of this, so that one of the first things we want them to do after they've had weight loss surgery, particularly if they take medications for high blood pressure, medications for type 2 diabetes, is to make appointments with their primary care doctors as well, so that adjustments can be done appropriately, so that, you know, if the blood pressure is normal and I take blood pressure medication on top of that, guess what? The blood pressure is going to go too far down, and then I may experience dizziness, I may experience lightheadedness due to a low blood pressure, which is obviously not desirable. So even more of a reason to follow up afterwards. A common question that comes is what to expect in terms of physical activity. Well, you know, they ask us.
Right, just
Yeah, of course. Go ahead, Kemal.
you're on the right topic now, like, because I was just reading some of our bariatric support groups, and you know, every once in a while I get feedback that if I'm not paying attention to you, but no, I'm actually paying attention to you because I'm actually following our other things here related to this episode. But one of the things, like here, of course, I won't give the name, but we want our patients pre and post, we want them to be with the Facebook group that we have, the bariatric support group. Well, it's very interesting, the things that we see there and what's being shared. Some of them are just like the success stories, but some of them, they are struggling with X, Y, Z, and then they are looking for different, you know, alternatives, and something that someone tried maybe helpful for someone else. But what I wanted to actually do, and I apologize for stopping you, but this is really important with what you're about to say. This patient is saying that they were able to tackle 5 labs around the Dover Silver Lake Park. I'm thankful for my surgery. It feels great to walk and not to be out of breath or body being in pain. So the issue that I see with, I think some patients may be struggling with this, if they see positive changes, why do they still need to see us, right? That's to either, I'm not saying that this is what I'm thinking, I'm just saying that this is what I hear, but because someone is able to do all these things, that's great, but one of the reasons that we want this to happen is we want them to follow up with us is because we want this to be not only permanent, long-term, and we want this to go, like this patient put their weight down there, down to 225. I don't know what their starting weight was, it doesn't say that. So this is great, but we want this greatness to stay there and even get better. So you were just talking about the physical activity.
Absolutely, absolutely. So, I mean, just even to tackle that point that you brought about, you know, why do I need to go back if I'm doing great? Well, doing great is fantastic. And of course, we want to share in that happiness as well, right? But more importantly, you know, why do we ask people who are perfectly healthy to have annual visits with their doctors, right? Because what we want to do is the doctors are trained to really pick on signs of issues that may be on the horizon, and picking them up early, you know, makes everybody's life a lot easier, right? We are able to resolve problems before they occur. Prevention, you know, an ounce of prevention is worth a pound of cure, right? It's very, very important. So also, yes, you're doing great, but we want to make sure, right? We want to make sure we're checking the blood work. We want to make sure you're eating the right things. We want to make sure you're engaging in you know, healthy activities in the long term, because we have the experience, we have the understanding of these issues, and we're just going to be adding that much more to your success if we are able to see you on a regular basis. That's very important. And then, of course, the issue of physical activity, you know, is important for us. It's very, very important. Now, patients ask me regularly, hey, doctor, when can I start exercising after bariatric surgery? My answer to them is as soon as you're fully awake from anesthesia. Because from our point of view, exercise is not defined by going to the gym and sweating it out there. Exercise is defined primarily by movement, right? Absence of a sedentary life. We want people to move. We want there to be movement throughout their day. And that the most foundational type of movement is walking. So we want patients to walk. You and I, when we go to our surgery center and there are bariatric cases, one thing that we observe is that we see patients accompanied by the recovery nurse walking around the hallways in the surgery center. This is within hours of surgery. Why is that important? It's because when we walk, not only we're going to really enhance recovery, but also we're going to prevent potential post-surgical, post-anesthesia complications, whether it's blood clots, whether it's pneumonia. But I do also feel, Kemal, in my many years of doing surgery, that a mind that is set to recovery actually recovers faster, right? And our mind is set in that mood when we are in a vertical position as opposed to lying down for hours. So getting those patients up and about has something magical about it in terms of getting patients to recover. So exercise starts immediately. Now, the intensity of exercise, the frequency will have to be gradual and progressive, and it will be dependent on the individual themselves, and people are different, and also on how heavy that person is. A person who is carrying 450 pounds may be a little bit slower in their activity as opposed to somebody who's about 250 pounds. So all those variabilities will dictate the timing, the intensity, and the frequency of the type of exercise that they will engage on.
This patient, saying, again, I'm just reading these from our support group, weighed in today at 152, lost 91 pounds, down to my goal of 135. This is 11 and a half months later, and she took a picture of herself from YMCA because she's about to work out. So this is kind of like, these are the things that we want to see. And I like the thing is, because of our daily case conferences, I do know these names anymore, so that's kind of interesting. When I see the results, it's just extremely rewarding because I know where she was, and now she's down to 152. Her goal is 135, but they know that they can only do that with the help of exercise, and that's a new lifestyle. The change is happening. Another patient they are just a couple months, and then they already lost 50 pounds. So this person was 388 pounds down to 338, and that's not happening with anything else, right? So they're not on cosmetic surgery. These are real chronic cases where people are seeing the results and resolution of their problems. But unless we follow through, unless we have the right settings, anything and everything that we do, we want that to become part of our lifestyle, part of our daily discipline. So this is, again, one of those, I mean, I had this magical surgery, magical tool, so I did my surgery and I'm not going to follow through anything. That's not going to work out. So you mentioned the walking, and again, this is, unless you should definitely get one of these, it doesn't matter which brand. It's important because when you have it, feel like you have to monitor it, monitor what you are doing, and then also seeing the comparison and where you are. And like yesterday, we had a late meeting with the ACO. By the time I got home, it was 8. I see that I'm down to like 2,500 steps, and I had to do something to get to the minimum 7,000 steps, and I had to go out and walk. It just, it's part of like what we do on a daily basis, every day or every other day. So then it becomes part of us. Now, Dr., from the emotional and psychological changes, what are the things that we can tell our patients?
So these are very important, obviously very important, and then they come up. And one of the reasons we do have a psychological screening, evaluation, and education before the surgery is precisely because these could be issues, right? In one sense, emotional struggles related to obesity, pertain to the fact that food becomes almost a source of comfort, a source of escape very often, right, Kemal? It's a vicious cycle that it's very difficult to escape from because, you know, you get down, you feel unhappy, you're not really able to achieve what you want because the weight, the burden of it is too much, and then you go to food as a way of getting out of that. But the food itself really reinforces the sense of desperation that the obesity brings with it, right? So after surgery, that is in a way not available, right? I mean, you're not going to be physically able to eat a lot of food. So that sometimes can have an impact if patients are not well prepared to understand that, right? So particularly for patients who are struggling with mental health, it is even more important in these days for them to be close to their counselors, to make sure they are following up with their counselors, to really work through these issues that can come up. Another important one is the image, right, Kemal? If a person has struggled for years looking at themselves the way they are, they may have a hard time, you know, coming to terms with that new physical image that they see projected of themselves, right? And these are not easy struggles, and there may be different facets and different layers to this, but again, important to be prepared for that potential. And particularly if they had a relationship with a counselor and a therapist, this would be a time not to run away from that, but also to continue that engagement. Other issues could be in terms of their relationship with their loved ones, Kemal, right? Because the physical transformation, the physical liberation that that person has could have an impact to their people who are close to them. That impact may be positive, but it may not be positive some other times. If their loved ones feel threatened, for instance, by the transformation that they are achieving, that could create problems within the relationship. And thinking through this and engaging your loved ones to go through the process and understand why you're going through this process to begin with could be a helpful way to navigate this. So you're absolutely right. There could be challenges from a mental health point of view and psychologically. And of course, we're there to support. And psychological support should not be limited to just before the surgery, but it should continue afterwards as well. But these are real things that don't necessarily become an issue for everyone, but a significant amount of patients could be facing them to some extent, at least.
Well, that's also why we are here on this.
Absolutely.
So,
yeah.
Now, we kind of just to summarize, there will be a lot of weight loss. So, and we want to keep this permanent, have this part of our life as long term. And while we are going through that, there will be different changes in our lives, physically and psychologically, and we want to prepare ourselves and also address these issues together. Because when you're on your own, this may not be working out. So you need your surgeon follow-ups. You need your, if it's necessary, nutrition follow-ups. Definitely your primary care once a year minimum for your annual physical minimum. And as you need it, as we may see the need, keep in touch with our office to make sure that we can identify these problems early on. Seeing the significant like tangible results, again, it's extremely rewarding for us because we work with all of our patients throughout this time, starting from the first consult to the surgery. And in some cases, I personally may not see or I may not interact with them after the surgery because the part that I'm involved is in the pre-surgery with the case conferences. But it's one of the best feelings that when I see, like I can recognize some of the people because they put their, we don't, ask them to do this. They want to put their prior, pre-surgery and post-surgery. And I'm like, these are not the same people. So that means this change is so significant, and very important. And we want to support our patients from all these different changes that they're going through. So, Dr. Irgau, thank you for joining us. We'll be back next week with other topics. But until then, stay safe and have a great weekend.
Bye-bye.